a skin disease that you probably haven't heard of, vitiligo. It affects about 45 million people around the world, and recently the FDA approved a trial for a new drug that could potentially help patients with it. So what exactly is this skin disease, and why haven't we heard much about it? Here with more on this condition is dermatologist Dr. Doris Day and Monica Holzer, a vitiligo patient. Thanks to both of you ladies for being here today. I'm going to start with you, Dr. Day. Tell us exactly what vitiligo is.
Vitiligo is an autoimmune condition that affects, as you mentioned, about 45 million people worldwide and 1 to 2 million people here in the United States. It's a common autoimmune condition where your body's immune system thinks that your pigment-forming cells, the cells that give your skin color, are foreign invaders and must be attacked. And often it starts around the eyes, around the mouth, and on the hands, the extremities, and can actually progress to involve the whole body, but unfortunately it's often very patchy. There's really no underlying health condition behind it. It's a skin condition, but it can be very uncomfortable, just and unsightly, and affect people's self-esteem.
And can it develop at any point in someone's life?
More than half the cases begin by the age of 20 and 95% by the age of 40. So if you've hit 40 and haven't had vitiligo yet, chances are it's not going to happen.
Right.
If you have a family member with the condition, you have about a 5% chance that you might have it. But because it's an autoimmune condition, and there is some genetic predisposition to these autoimmune conditions in general, things like a certain type of anemia or thyroid problems, you might have a greater family history of those other autoimmune conditions, not just vitiligo itself. So, you know, one doesn't cause the other, but oftentimes when we see one, we also see others associated as well.
Right. And Monica, you are being treated for vitiligo,
Yes.
is that right? When did you first notice the condition?
22 years ago, yes. All of a sudden one morning I was very tan because it was in the summer months. I look at my wrist, and on the left wrist I have this beautiful round white spot. I didn't get alarmed because I thought it was so beautiful and didn't itch and everything, and didn't pay attention. 1 month later it was exactly the same thing in the other wrist, and it was so scary. I got so scared because I'm like, what it is? I went to the dermatologist, and within a few seconds he told me my life. And he said, you're going to be full from head to toe with spots all over your body. Imagine 20 years old. It was a big thing.
Was this devastating for you?
Absolutely scary, devastating. And you know, at 20 years old, all you think it's yourself and how you look and things. It was frightening.
And you loved going out in the sun, right? Which
That's
is something
my best
that made
friend.
It worse, right?
Yes, absolutely. I didn't know what to do with it. You know, my insecurity went to the stars. I felt so weak, and I didn't know what to do.
And Dr. Day, what are the treatment options available right now for this condition?
So the sooner we treat it, the greater the chance that we have of getting some of the pigment to recover. So the idea is to turn off the immune process that's making this happen. It's a localized thing. So the first thing we'll try is some topical cortisone, prescription strength topical cortisone. And then on top of that, if that doesn't work by itself, there's some steroid sparing products, something called Protopic. That's also a prescription. But these can take a very long time to work, and they don't prevent other lesions from coming on.
Right.
Now, when I say lesions, I mean these are not contagious. This is not something that you can spread to yourself, although anywhere you have trauma in the skin, so from a scratch or a bug bite or even just generalized stress, can make this come out a little bit more. So you have to manage those parts as well,
right,
to try to prevent you from getting new spots as much as possible. That's what you have control over.
And obviously when you tan, or if you have a darker natural skin tone,
yes,
this condition will be more visible, correct?
That's true. But on the other side, speaking of tanning, sometimes we use controlled light to try to help stimulate that pigment to come back. So while those areas, because there's no pigment to protect you from the ultraviolet rays, are more sensitive to light and can burn more easily, so you have to be careful with sun exposure, besides the fact that they become more visible when you have a tan, we can gently use light along with some topical creams that make your skin even more sensitive to light to try to encourage the immune system to turn off, because sunlight is also suppressing the immune system, and it can help re-stimulate those pigment cells.
Okay. Now, Monica, we know this is obviously not easy for you to talk about at all, and we're very appreciative that you've come on the show today to tell people about this. But right now, since you don't have much of a tan, it's not very visible.
Well, I have it everywhere in my body, but you know, I know how to dress. I know how to hide it a little bit. I found the perfect makeup, and that's been really the most amazing thing.
Is there a makeup that exists specifically for this
condition?
Yes,
yes, and it saved my life, I have to say, because it makes me feel confident. And I'm a stylist, and I've been doing this for 15 years, and when I work with women, I I realize how confidence it's all.
It's
When
all
when you see confidence on me, you don't even look at the spots.
It's true.
I look like a zebra in the summer. Let me tell you. I don't know, a panda, zebra. I'm still deciding which one.
But there is a new drug that might give you some hope as well. There's a drug called Scenesse, and this is an injectable drug that helps mimic the body's ability to make pigment back. And this is being done along with specific types of UVB light exposure in a very controlled condition, might help stimulate those cells to come back, and might even be used later for people who have light-sensitive conditions to give them some extra internal protection against the sun. So there is a lot of ongoing research, so you should have hope in that.
Oh,
that for
nice.
now you look beautiful and you can work with makeup and try to encourage the pigment back, and I know you're using some of the creams, but hopefully within the next few years or so we'll have some new medicines that will really help recover that pigment.
Oh, thank you.
And so, Monica, now you are in a good place, right? You've gone on from your 20s when this was devastating news to you. You seem confident now, and
Yeah, absolutely. Again, my job has been helping me, you know, get over my fears and things like that. I actually started this website, monicasbeauty.com. I'm sorry if I say, but
no, that's great. Monicasbeauty.com.
I would love to for people to share their story. I think I learned that beauty marks, as I call them, they help you be yourself. I don't know. I cannot see myself without them at this point.
They're very individual. Yes. And has your treatment, have you tried any of these things, Dr.
I've tried, and I have to say, you need a lot of patience. And it happens in a very slow pace. And, you know, if you're single, no kids, sure, you can dedicate your life to it. In a real world, I have to say, you need time. And
you're a busy working mom, as we all are, right?
Yes. I think makeup is definitely
a good way to
something
go.
that can help.
And maybe there'll be some hope in this new drug. We'll see. Monica, thank you so much for sharing your story. And people can go to monicasbeautymark.com to share their own beauty stories, correct? Oh, wonderful. Thank you, Monica. And thank you, Dr. Doris Day, for all that insight. And you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.